Hi guys, welcome back to my channel. So today I'm going to be talking to you about safe sex and birth control. Before we start this video, I just want to say that I am not a healthcare provider, and if you have any questions about STDs or safe sex or birth control, please contact your local healthcare provider. What is safe sex? Safe sex is sexual contact that does not involve the exchange of semen, vaginal fluid, or blood between people having sex. There are many forms of safe sex and birth control. The most common form for safe sex and birth control are male condoms. When used correctly, male condoms can prevent pregnancy and STDs up to 82%. Male condoms are the most popular form of birth control and STI protection because there is no prescription required, and you can get it at your local pharmacy or your local grocery store most of the time. You can also get male condoms through your local healthcare provider as well. Some little facts about male condoms is they come in all different shapes, sizes, and materials, so do keep that in mind when you are researching male condoms. What is a male condom? A male condom is a thin covering that is worn over the penis. It covers from the head of the penis all the way down to the shaft of the penis. I also have made a video on this not that long ago about how to properly put on a male condom, and I have posted some links below so that you can go check that video out. There's also another form of condoms, and this is called a female condom. Female condoms can only be worn by people who have a female anatomy. Female condoms do not come in different sizes. They are a one-size-fits-all, so please keep that in mind if you are looking for female condoms. Female condoms, when used correctly, can prevent against STIs and prevent unwanted pregnancy up to 72%. They are also another popular form of birth control and STI protection because they do not require a prescription. And you can usually get your female condoms at your local store or through a healthcare provider. Another form of birth control is a diaphragm. Diaphragms do not protect against STDs. They are only a form for birth control for people who have female anatomies. A diaphragm, when used properly, is 88% effective. Diaphragms are required and need a prescription. You do have to see your local healthcare provider to get and obtain a diaphragm. What is a diaphragm? A diaphragm is a dome-shaped device that is inserted into the vagina a few hours before having sexual activity. After sexual activity, you will keep the diaphragm in your body for a few hours and take it out. Diaphragms are used to prevent pregnancy only and not STDs. Another form that is similar to a diaphragm is a cervical cap. Cervical caps are 70% effective, and they do require a prescription. You do have to see your local healthcare provider as well. Cervical caps are very similar to a diaphragm. It is a silicone or soft-shaped cup that is inserted in the vagina, and it goes up by the cervix and makes a cupping suction over your cervix so that semen cannot get into your cervix, and it will help you prevent against an unwanted pregnancy. Another form of birth control is a birth control sponge. It is very similar to a diaphragm and a cervical cup. There is no prescription needed for a birth control sponge, and it is 70% effective when used properly. What a birth control sponge is, it is a sponge or a soft-like material that has spermicide on it. You usually wet the sponge and you insert it into the vagina a few hours before sexual activity. Cervical sponges can be worn 24 hours before having sexual activity. Another form of birth control is spermicide. Spermicide, there's absolutely no prescription needed. It is 70% effective when it is used correctly. Spermicide is like a gel or a cream that is inserted into the vagina a few hours before sex and after sex to prevent pregnancy. Spermicide does not protect against STDs or STIs. Another form of birth control is the birth control pill. A prescription is needed for the birth control pill, and there are many different brands and types of birth control pills. You always use it as directed that your doctor says. It is 90% effective when used correctly. Birth control pills contains hormones such as estrogen and progesterone that help prevent pregnancy. There are also birth control patches as well. A prescription is required for a birth control patch. It is 90% effective, and it is basically a little square patch that you can place on your stomach or your arm or wherever your doctor directs it for you. Birth control patches are a very effective form of birth control, and they are really nice. However, the only downfall is that you have to regularly replace your birth control patch. There's also vaginal rings. A vaginal ring is basically a circular ring that you insert into the vagina, and you take it out as directed by your doctor. They are 90% effective, and they are also needed. A prescription is needed to obtain a vaginal ring. Another form of birth control is an IUD. An IUD is a medical device that goes inside the vagina and is 99% effective. It is one of the most effective forms of protecting against pregnancies. IUDs is a small procedure that is done in the clinic. It usually takes about 30 minutes to do. You do have to see your local healthcare provider to obtain and get the IUD. There is also the birth control implant. It is 95% effective, and it is a small implanted device that looks like a rod that is inserted into your arm. You also have to have a prescription to be able to get the implant as well. Then we have the birth control shot. The birth control shot is 93% effective. You also have to go in and see your local healthcare provider. It is basically a shot with certain hormonal chemicals in it that helps prevent pregnancies. Now, there are many more forms of birth control out there, but these are the most common forms of birth control and STD protection. If you have any further questions about STI, STDs, or birth control, please look and visit your local doctor or pharmacy. Thank you, and have an awesome day, you guys. Bye-bye.